This is our research lab training, which is designed for medical students, for residents and fellows to do the research within the clinical practice environment. It is designed for people who are interested in research to learn about research methodology from the scratch, from finding the issues and topics in your department and in your organizations to manuscript submission for the journals and publication. So welcome to our program, and I'm happy to invite Angela to start the meeting.
Good evening, everyone. Thank you, Dr. Marsban, for this introduction. My name is Angela, and I will be the moderator for today's meeting. So thank you all for joining us today. I would like to thank Dr. Marsban for providing me the opportunity to moderate this meeting today. I would also like to thank Dr. Kinal Bhat, Dr. Isha Mehta, and Marzia Najafi for their contribution in producing the material for today's meeting. So, the Research Liaisons Training Lab is a project-based research lab where you will have the chance to practice and learn basic concepts in research. It will not simply just be lectures. This is important as it means you will be actively involved in the learning process through completing your project activities. The main goal of this training lab is to provide educational support and facilitate improvements across different departments. This program aims to help you conduct value-adding studies, which can either be by identifying an existing knowledge gap or resolving a problem. So there are numerous published articles, but our goal is to help you.
We can't hear you, Angela.
Yeah, can you mute, please, Angela? Thank you.
Can you hear me now?
Yes.
Yes, thank you.
Sorry. So I'm not sure where I was cut off, but this program aims to help us all to conduct value-adding studies. Sorry to interrupt. Was I cut off from the beginning?
No. We heard you. Yeah, we heard you.
Oh, okay. Yeah. So this program aims to help us all conduct value-adding studies, which can either help identifying an existing knowledge gap or resolve a problem. So there are numerous published articles, but our goal is to help you produce quality research that adds value to the medical literature. After the final meeting, you will all be able to conduct research projects independently and read the research team. This can only be possible via the involvement of the liaisons with their project activities. Each meeting will consist of a presentation that will explain various concepts in research. You will receive guidelines after each meeting that will assist you in practicing the topics discussed. Additionally, there will be a worksheet for each meeting that will be used by the residents and fellows for performing exercises about the concepts taught during Dr. Marsban's presentation. For example, in today's guideline, we will discuss how we can find a research topic, and we will present a worksheet that can be used as a tool. At the end of the meeting, we will go through the guidelines and worksheet in order for the participants to learn how to use them for the monthly engagement. So there will be a total of 14 monthly meetings, and each one a step or a concept of research will be discussed. And it will start, like Dr. Marsban said previously, from how to find a research project. Then we'll move on to the stages of writing research. And then we will finish with teaching about implicit research capabilities. These include areas such as how to find grants and discuss authorship and research. It is fundamental to complete each meeting as it will make understanding the concepts presented in the next meeting much easier. This research lab is very important as it acquaints us all in understanding basic research concepts. Now, research plays a very important role in improving clinical practice and provides several advantages. It has an impact on your practice and performance as it encourages and teaches us to follow evidence-based practice. Evidence-based practice involves making changes in clinical diagnosis, clinical practice, treatment decisions based on research evidence. It will also improve your health information management and assist you in providing the best cost-effective care. For instance, research can be done to understand the cost effectiveness of introducing a new health technology to replace an older one. Research can also aid in resource allocation. So research allocation involves allocation of resources through service research reports. These research reports will help in utilization of health services, and we can measure the probability of providing an intervention when needed, the probability of requiring this intervention again, and the probability of receiving an intervention based on previous experience. Such reports and research helps guide the allocation of funds in your clinical practice. Research also impacts your career. It can make you stand out in your field of interest and help you make internal and external connections via academic collaborations. So these collaborations are very important because they can assist you in finding connections to undergo a certain type of research you would not have been able to otherwise. It can also allow for data sharing between institutions to expand research opportunities. Finally, research impacts our patients and community. Through research, we can understand certain populations, what certain populations need to ensure that health equity is provided in clinical practice. Research can also help in developing new strategies to improve patient education. To conclude, research system management is a collection of information that can lead to, firstly, preserving the health of the population, secondly, modifying clinical priorities, thirdly, to use resource allocation strategies, and finally, to link health research to other disciplines to maximize benefits. So I would like to thank you all for your time. We also have a few minutes right now to allow the participants to introduce themselves. So whoever would like to go first can raise their hand.
Please, Dr. Amin.
Hi, this is Amin. I'm from neurology in South Campus.
Glad to meet you, Doctor.
Thank you.
Dr. Elias.
Hello, this is Elias Kima from Internal Medicine Palm Springs campus.
Nice to meet you.
Thank you.
Ambar Khan. Dr. Mariam.
Hello.
Hello. We are here.
I'm Mariam Bayat Mokhtari from Family Medicine. Sorry for being a couple minutes late. I was in clinic today.
Glad to hear you.
Thank you.
Dr. Ambar Khan. Dr. Frank.
I am Frank Matuzak. I am at Palm Springs, and now I'm HEMONC at Larkin, Maine.
Nice to meet you, Doctor. Dr. Badar. Please unmute yourself.
Hi, everyone. You hear me now? Hi,
Yes.
everyone. My name is Badar Sabin. I'm from Addiction Medicine at Palm Springs.
Glad to meet you, Doctor.
Thank you.
Dr. Catherine.
Hello.
Hello.
Everybody can hear me. I'm Catherine Abdunnoor, one of the family medicine residents at Palm Springs campus.
Nice to meet you, Doctor.
Same here. Nice meeting all of you.
Thank you for joining.
You're very welcome. So I raise my hand. So that means I introduce myself.
Yes, you can. I think you can lower it in this. Thank you so much.
You're welcome. Thank you.
Dr. Mary.
Hello, I'm Mary Michael, and I am part of the dermatology program from Larkin Palm Springs.
Glad to meet you, Doctor.
You too.
Dr. Pramod.
Hi, my name is Pramod Bhattarai. I'm one of the critical care fellow at Larkin Palm Springs campus. Nice to meet you all.
Nice to meet you, Doctor. Dr. Noreen.
Yes, I'm Noreen from the endocrine program. Hello?
Thank you for joining. Thank you.
Yeah, I am from endocrinology fellow.
Good to see you.
Thank you.
Dr. Adam.
My name is Adam from the pulmonary at Larkin, Palm Springs.
Great to hear you. Dr. Oleg.
Dr. Odin, critical care fellow.
Good to meet you, doctor.
Same here.
Dr. Roshani.
Hello, I'm Roshni. I'm part of PM&R at Palm Springs South.
Thank you, doctor, for joining. Dr. Roshni. I learned it. And Dr. Nicole, please.
Hi, I'm Dr. Nicole Clark. I'm from the Nephrology Fellowship at Palm Springs campus.
Nice to hear you.
Thank you, thank you.
Dr. Marzi. Dr. Hain. Dr. Shruti, please.
Hello, yes, my name is Shruti. I'm sorry, I'm not in town right now or in US right now, but a research fellow at Larkin University. It's nice to meet you guys.
Thank you for joining. Dr. Rishpa.
Hello, everyone. My name is Rishpa. I'm also a Larkin fellow.
We cannot hear you, doctor.
Is it better?
Yes.
Okay. Hi, everyone. I'm also a research fellow at Larkin Hospital.
Thank you for joining. Dr. Ricardo, are you with us?
Hi, pleasure to meet you guys. I'm also a research fellow with the Larkin Community Hospital, and love to be able to work with all you guys, and let's get the best research we can and learn as best as we can here together, all right?
Thank you, doctor, for joining. Dr. Jajugania.
Hi, I'm Jajugania, a geriatric medicine fellow from Palm Springs campus.
Nice to meet you, doctor. Dr. Faris.
Hi, my name is Faris Hawatmi, dermatology resident at Palm Springs campus as well.
Thank you for joining, doctor. Is there anyone else?
Looks like Amber Khan cannot unmute himself. He's texting he's in the chat box that if you can unmute him.
Laura, can you help about?
This is, who is it? Can you please repeat?
Dr. Amber Khan, Dr. Amber Khan. Hello,
yes,
doctor. Thank you for
she
joining.
Just joined. She just joined. Yes.
Okay, okay. Welcome all to this program and thank you for joining. It's my pleasure to present today our presentation for the first step in the research, which is finding an issue, finding a topic for research. Let me share my screen with yourself. And with all of you, I can share. Can you see my slides?
Yes.
Yes.
Okay, okay, great. Okay. I appreciate Angela. I appreciate Kinal, Isha, and Marzieh, all doctors from Team 11 and from international researchers who assisted our department to develop the material for this training lab and to be with you in this afternoon. It's not a good time for learning, but I'm trying my best to make it attractive for you with interactive talking and asking some questions and making some examples for you to make it more attractive. So this is a research training lab. My friends, this is not lectures to say something from the evidence from books or present something, some slides or copy pasted some material for you and say it. This is a research training lab What does it mean? It means that we will accompany you, we will help you, we will coach you and mentor you step by step during your research project. So we will have monthly basis meetings with together. In each step, we have a topic and we will have a worksheet. So on the worksheet, we will work with together and we will learn from each other. I'm learning from you and you're a part of our team, and our research fellows, Dr. Ricardo, Dr. Rishpa, and Dr. Shruti, and Marzi, will learn from you. So this is a flat communication. This is a collective learning from each other, and we can help each other to progress with our ideas and topics. In each module, you have a short presentation, a short lecture, about 20 to 25 minutes, and then a worksheet and a guideline. A guideline is a brief description of what are the steps and what you should do, what we should do during our common journey with together. That's important to know, a step by step in a practical way, very practical way, based on the practice issues that you have and administrative issues, quality issues, patient and family issues that right now you encounter and face with within your departments and wards. Not something from literature, not something from Google search or from Cochrane or databases, just learning by doing it together, step by step. So this is a practical mode of learning, and a training lab, a training cohort with together. The learning objectives of this meeting are recognizing areas of research interest. It's important to find something for research. It's important to know that we cannot repeat others' researchers. We cannot mimic the methods and writings of other people, of the other authors that we can find their articles in PubMed or somewhere else. Our role is to find issues and topics relevant to our interests, our organization, our practice issues, and our customers' issues, and customers are patients here, patients and families and community around you. So the first step is to learning how to recognize areas for research. And the second one, how to prioritize the research areas. So any of us have a list of things that we like it. We like to explore something in our subspecialty area, in our organization, in our clinical offices, and the places that we have worked with together, our teams, our department. But it's important to prioritize. Why we should prioritize? Because we should pay and we should spend our time on something that adds value to ourselves, to our professional promotion, and to our organization and department, and to our patients and families. Not something only for writing research or having a publication. The research is not for research. The research is for community. The research is for adding something to the current medical literature to be helpful, to make an impact, to make a change, to lead a change through research, and to find some solutions for the people and us, for our challenges that we have faced and we face every day in our practice. So it's not writing for writing, it's not research for research, it's not writing for publication, it's not writing for graduation. If you have this type of presumptions, please change it from the beginning step. We are doing research and we are spending our time to find some solutions, to add something to our community, to our colleagues and organizations. And then listing issues and problems under the selected area. And then prioritize again the issues and problems. And then proposing a topic and defining a research question. How? Let us see. This is the journey that we will have during next 14 months with together. The first step is where right now we are. It's the identification of the research issues and topics, then prioritizing the healthcare issues, then issue a statement and defining the research questions, then finding reliable publications and resources to state the issue. It is important to find reliable ones. Then critically read and review relevant articles, critically. The golden point is critically. Here is reliable resources. Then select appropriate study design. Study design, study methodology is important. Describe considerations for ethical conduct of research. Ethical conduct is important to protect the rights of our subjects, of our human subjects. The patients who are recruited for our research are important. So ethical conduct is important. Even intellectual property and ownership of the intellectual aspects of the research is important. So it's very fundamental and essential to know what's the ethics of research. Is it something on site or it is something in the text, in the body of the research? It's good to know about it. Identify common challenges during health research to be prepared, to make it materialize, to make it feasible, develop a proposal for a primary or secondary research. This is another step, another skill. IRB, Institutional Review Board approval. To have the approval of ethical conduct of the research and collect the data, how to collect the data, how to manage and analyze the data, how to write a manuscript, and how to submit our manuscript to a journal. All of these steps will be considered and will be educational and learning objectives of the future modules. Okay, let's start with research area. Research area is the first step of starting the research. So some of us like to do the research in our subspecialty field, something like a disease condition, COVID-19, cardiovascular disease, chronic kidney disease, arrhythmia, mental health, something like that. So first of all, define what's your area of interest. So research area addresses a broad scientific discipline that is a part of your professional, your career interest, or the area that is essential or beneficial for your department. It could be a disease condition. So focus on the disease condition, on the disease area, on the subspecialty that you think it's your best area for research. Sometimes you are not focused on a disease. You want to be focused on a systems concept, on a public health concept, like patient education, like community intervention, like patient-centeredness, like patient safety. Some of you might be interested in quality improvement. It can be a research area. You will ask yourself, may I do some investigation or research, literature review, or do an impact on the quality of care in my department, in my office, in my practice? Can I help others to improve their quality, the quality of their practice, or how to manage the relationship with patients, with families? So it might be a research area that you are focused and centered on a systems concept, like patient-centeredness, like quality improvement. Maybe the research area is an organization or a community hospital, a location of work, a department. Clinical research, for example, clinical research organization. If you are working with a clinical research organization and you would like to do some research about how to improve the process of clinical research, how to improve the ethical consideration of clinical research, how to improve the administrative process in your organization. So you can focus on the organization, on your location, on your service provider, or you can focus on a concept, or you can focus on a disease condition. This is the first step, but in addition to these items, you can consider your self-interest. Are you interested to do some improvements? Are you interested to continue your career with pharmaceutical companies, in conjunction with pharmaceutical companies, in conjunction with a research institution, in conjunction with an academic organization, with a university? You want to be a faculty or not? So consider all of these for defining and recognition of research area for your project. This is important to identify the research area because you will spend your time on it at least several months, a few months, or sometimes years on your research. And you will continue the research as further research after doing the first one. When you published an article, the second one and third one can be relevant to the first one, to be in detail and more professional. So it's important to select your first area of research or your current area of research wisely. How to identify research area? From where? You might ask me, how can I identify, how can I design my mental map to start working on ideas? From where these ideas come? First of all, and best of all, are community issues and social debates. Patients and families that are a part of communities. If you find something challenging with your patients and families, if you find something about their feedback and experience with your care, with hospital care, it's important to value for those ideas. If you have a system that documents suggestions or complaints of the patients, it's better to have all of these documented. You know, the modern and developed hospitals have a documentation system for patient suggestions. How they call it? Can anyone bring an example for incorporation of patient suggestions into policies or research?
By the use of any surveys, if you get at the end of any like patient care in outpatient setting or any setting, if you get like a feedback survey from the patients and families, probably that can be one of the ideas to use.
May I ask, are surveys proper tools for exploring patient ideas? Surveys are appropriate tools to know the patient ideas.
If they design well, they can be appropriate. Depends on the kind of survey we are using, right?
Great, great. But in addition to surveys, we can have some patient and family advisory committees, interviews, focus group discussions with patients and families to explore their ideas, to know which areas are appropriate, proper, and value-adding for research. So those are valuable resources for finding the research area. The other one is peer conversations. When you talk with your colleagues, when you talk with other residents, fellows, faculty, in the meetings, in corridor talks, in journal club, in seminars or conferences, you're talking about some issues there. So just make notes. Have a notebook to make notes for potential items, potential areas for research. Clinical practice gaps. When you see clinical practice gap in your daily practice, about communication gaps with patients, communication gap between clinical team members, gaps in documentation, gaps in time, wait lines, double working, overlapping, unclarified roles and responsibilities. Or you have unusual cases like case reports. You have novel approaches, perceived problems, case management issues. Those are areas of research. Please find the area of research from these resources, not from Google search. You know, the thing that is routine between researchers, particularly students, and educational areas, academic trainees, is finding something from the online resources and then mimicking, repeating, replicating something like that with the same methodology. It's not the good way to spend your time and energy. Find something in your area of practice to add a value. Literature review, finding gaps in evidence. When you read a systematic review or a scoping review, there is a section in the article which is called discussions, further research, gaps in evidence, and limitation. We can find gaps in evidence there that authors address the areas for doing research later in the future. Opportunities to contribute to clinical literature. From these literature reviews, we can find these opportunities, how we can move forward with research after research that has been done by other researchers previously. Daily operational and administrative issues and communications. Problems that I told with documentation, discriminative experiences, it's very important. It's very important. If you experience something discriminating in healthcare services for different ethnicities, different races, different socioeconomic status of the patients, or between the healthcare workforce regarding the originality, the language, religion, race, ethnicity, skin color. It's very important to address it in your research in a constructive way. You know, research is finding solutions, addressing and highlighting something, then finding some solutions for it, and sensitizing other people not to repeat these discriminative experiences. If you find something challenging in policy and management, in leadership initiatives that improve the situation, and you want to help the managers and leaders to understand it better, to have better ideas and better solutions for that challenging situation, you can help, you can assist through research, because research is the language that you can bring the ideas, you can sensitize the leaders and managers to think about some challenges, some issues in the organization. To continue it, we can think about that. A great place to identify research ideas is from our own clinical practice, not from others' articles. If you encounter problems but cannot find solutions in the scientific literature, that's a great idea to work on it. You may also want to evaluate the way evidence-based care has been implemented at your institution. So you can measure something, you can address some issues and shortcomings in evidence-based practice at your organization. Just address it. Just describe it in your department. So it could be a patient-specific clinical question like this. Patient-specific clinical question. Or institutional concerns related to quality measures like this. Or you want to address a need to have a professional department, a part of a process, or a department at your organization, a person who is expert in some areas, and you want to justify the resource like this. Or you want to address process improvement through research, process improvement, quality improvement, like this question. All those are clinical, but from different perspectives, from different sides, and to respond different problems and issues in healthcare system. I just searched the PubMed, to find some examples for you. Please look at these items, look at these articles. These are published articles at PubMed. You can find this one, Social Support in Cancer. How do patients want us to help? This is a patient-specific clinical question, but researchers addressed it, highlighted it, and responded to it. You see, how is the value of this research? Social support in cancer. The other one, a question prompt list for patients with advanced cancer in the final year of life. You see, this is a response to a question from patient side. To address the quality measures, clinical quality and patient experience in the adult ambulatory setting. This is a published article, but in the research area of clinical quality or in the research area of patient experience. These are concepts. You see, these are not disease area, but these are concepts that you can specify, you can customize, you can address some issues in a department in terms of clinical, in terms of public health concepts or systems-based issues. Quality of prescribing by physicians versus nurse practitioners, physician assistants. You see, justification of the resources and also the quality again. Data quality shortcomings. You see, this is an administrative issue, data quality shortcoming in a disease area. So it's important to understand the role of data management and quality of data. Physician wellness is an issue for all of us. Workforce wellness and how we understand physicians as a part of the system, that their wellness status and wellness score is important to all of us. Mental health of the workforce is important to all of us. So please select it as a research topic. It's a hot topic now. And all of accreditatory agencies address these in hospitals and organizations. So if you are a researcher in this field, you will publish your article, your manuscript very fast, very quick, because it's a hot topic. Quality improvement. Quality improvement is another hot topic and value adding, because quality improvement projects are not only writing for writing. They are making some impact in your daily practice, in your team communication, in interprofessional communications and collaborations. Quality improvement in gynecological oncology, current success and future progress. Improving operation room efficiency. Efficiency is cost-oriented, effectiveness and cost at the same time means efficiency. And EMS quality improvement programs like improving pre-hospital aspirin administration rates. You see, this is a quality improvement. So you can address many types of issues and challenges to have a research. Don't think that only case reports and systematic reviews are research. The research includes many types of things: clinical researches, quality improvement, qualitative research, asking the people, exploring ideas through focus grouping and interviews. What are written sources to develop an idea from? A research idea comes from which written resources? First of all, evidence review. If you see in evidence reviews, in systematic reviews, scoping reviews, an unmet need or a gap, the researchers who have done scoping review, they know that scoping reviews address a gap in current understanding, in current evidence. So you can find ideas for research if you study scoping reviews about your research area. Practice data. We should have access to the clinical data of our patients through EMR, EHR, MedHouse, everything that you call it. Which database are you working right now, doctors? Can you bring some examples? EHR or EMR that right now you are working with?
Our EMR is right now MedHost we are working with most of the time.
Okay, is there any other database that you're working with?
From Larkin, no.
No. Okay, what about South Miami?
We use MedHost in South Miami, but on the other facilities we go, we use all different ones.
In satellite sites, I think there are other databases as well. Is there anyone who works with Epic?
Yes, I work with Epic and Cerner.
Okay, great. Do you have access to the clinical data for research purposes?
I don't know.
If you want to do a research, what you should do to have access to the data about your patients, about patient lives, is there a facility or facilitator to provide the data for research for you?
I'm not sure about MedHost.
Okay, that's the problem. It's our role. Laura, Shruti, Rishpa, and Ricardo, we should work on it to provide their access to the clinical data in our EHR, EMR that we are working at Larkin. That's the key to research. You know, if you want to have access to collect the data, you should be allowed, and the permissions to have access to that data is important. So patient data, patient-reported outcomes are important. Patient-reported outcomes are different than the clinical data that you enter into the databases. That's patient-reported from the patient side. The things that patient says with their language, the perceived clinical outcomes by the patients. So it's an advanced mode of clinical data, and it's accessible in advanced research institutions. Incident reporting system. It's important. What's the importance of incident reporting system? Can you explain?
I think it would be most important is root cause analysis. So we fix the cause and then it won't get repeated.
Great. But if you find a common issue for several cases, several incidents, not only for one case to do investigations, to do RCA, to do M&M, for several cases, you see there is a common root, a common reason, an administrative or systems-based reason or challenge that causes several incidents. That's important to understand. Incidents doesn't happen because of personal issues, because of personal mispractice or mistakes. It's because of systems issues. It's because of different challenges that happens continuously, and the barriers to the consequent issue are not enough and adequately designed by the system. Do you know Swiss cheese theory? Swiss cheese theory. Please search it. Please Google it after this meeting.
When you found the loopholes in one system, like align it and the same, what I would say, like you could reach out the root cause analysis by using the Swiss cheese model.
It's relevant to incident reporting, to RCA, to patient safety, but please search it. For the next meeting, we will discuss it. Hospital reviews, complaints, patient experiences are the other written sources to find research issues. Administrative data, if you find waiting lines, delays, complaints, lack or shortcoming of human resources, issues with tasks and duties, it's not clear who does what, who reports to who. Those are administrative data. So you can find something in this type of data that are written in annual reports, in department reports, formal evaluation or accreditation reports. There are many formal reports that supervise and evaluate your departments. And those reports are available through your program coordinator and program director. So you can ask them, what is the priority of our department to work on it to improve our situation for the next evaluation by ACGME, for the next evaluation by accreditatory review committee. Those are very important because they solve something in your department. So we are here. How to prioritize these healthcare issues and research areas that we have listed. You will list the research areas and you will list issues and problems under your research area in the worksheet. So please do it through next month. 1 month you have time to recognize, to realize the area of research for yourself and for your department based on the things that we have discussed together. And then list some issues and challenges under your research area. How to prioritize those lists? Maybe you're listing 5 things, 10 things, or 30 items. You have a list of problems and issues every day because you are smart, you're young, you're thinking, you have critical thinking about everything. You analyze the things that happens around you. So you may understand various issues around. You can list them, make notes about them, and then prioritize. How we can prioritize? How we can recognize which one is more important to put my efforts into it for my research, for the graduation purposes, or for helping others, for adding value in my department. With these items, put some criteria in the left side, some criteria. We helped you by this, but you can change them. You can discuss with your colleagues in a didactics in your department with your faculty to change this criteria to something else that is more fit and appropriate for your department. But these are the things that recommended by reliable organizations. Appropriateness. Focus on health interventions that are known to scientific resources. So it's important to choose something appropriate. The second one, relevant to vulnerable, high-need, segregated population. Something that represents the priority health conditions. These are the list. In this Healthy People 2020, you can find the prioritized areas in United States by CDC. So you can find many issues here in this list. And something that addresses the resources for evidence conducting research to be feasible. In the feasibility area, you can find something that is available in the evidence, effectively utilizes existing research. If you want to work on a topic that is not available in the resources, in the current resources, in current published articles, it's tough to have enough information, scientific information, to develop your idea on it. So it's better to work on something that is feasible and to work on something that is a part of your department commitment, and your department will support it. You know, it's good to align your ideas with your department, with the challenges and needs and requirements of your department. So then after, you can score the alternatives from 1 to 5. Here, our presumption is we have 5 alternatives. If you have 6 alternatives, 6 research area or research issue, the score and the rank would be from 1 to 6. So the scoring system is dependent on the number of alternatives because you're comparing each of these alternatives with the other ones. So the 1 is the least and 5 is the maximized value of this alternative regarding appropriateness, of this alternative regarding feasibility, of this alternative regarding importance. What topics are important? The topics that represent a significant disease burden affecting a large proportion of the population. If you work on a case that is so rare in the world, just one case in one country, and you don't have any idea about the case and the disease area, why you should report that case? You know, if you are able to work on and affect a large proportion of the population, and you have a lot of issues in your department, you can work on population subgroups. So please work on it. Please impact a larger population, a larger target group. It doesn't mean that case reports are not a good type of research methodology. Those are important, those are valuable, and right now we value those articles and manuscripts. But in the hierarchy of research, those are the lowest level because it's only narration of the story of one person and one patient. And if you select a larger targeted group, the value of your research would be higher. If you do something, if you make an intervention in your research, it has a higher value versus doing just narrating and a storytelling or description of one case that I have visited in my office, you know. But those manuscripts are valuable as well. Don't say after that Dr. Marsbaum told. don't do the case reports. Case reports are good. Case reports meet the requirement of ACGME and graduation, but the value of quality improvement, value of clinical research, value of qualitative research is something else, because you make an impact, you change something, you address a need, you highlight an unmet need within the targeted group of population. Okay, if you can help decision-making, healthcare decision-making, if you can lower the costs for a large proportion of the global or US population, it would be more important. And if you support, if this issue and topic is supported by one or more stakeholders, for example, your department need an intervention for change, for improvement of the situation, if they need, if more departments need it, if Larkin Hospital need it, if many hospitals need your research to do something for healthcare services, it's more important. So please read the other items for importance and score. And then at the end, the potential value is important as well, because something that improves healthcare outcomes is very valuable. Something that reduces significant variations in clinical practice is valuable. Something that reduces unnecessary burden on those with healthcare problems and vulnerabilities, it is more important and more valuable. If something reduces the costs, your research topic would be very valuable. So then after, score all those alternatives and compare it together, then select the best one. The maximized importance, maximized value, maximized feasibility. So I'm sorry, it was long, more than 25 minutes. I'm so sorry, but I'm hopeful that we can navigate your skills and competencies into research and into publications. I invite the next person in our team member, Angela. You will continue. Thank you for listening all. Thank you. Let me know if you have some questions.
Thank you, Seema. It was very
Thank you. Thank you so much.
Thank you so much, Dr. Marsban. So I'm just gonna quickly show you the guideline for this module and the worksheet so you guys are familiar with how to use it. So let me know if you could see my screen.
Yes, we can see it.
Yeah. Great. So this has been emailed to everyone, I believe, by Laura. So the first one here you can see is the instruction guide. It just explains what Dr. Marsban has already told us on how to develop a research topic. You can read through it. It's a summary of the presentation, and it helps you recognize your areas of interest and helps us list the issue. So after reading through this guideline, it should not take more than 2 minutes. You can move to the worksheet. So I'll share the worksheet right now. So in this worksheet, it will help you list your areas of research interest. So this could be, as Dr. Marsban previously said, through your fields of interest, from ideas you've had from meetings, discussions, or peer talks, or also through surveys you've had with your patients, or from ideas from your practice and patient management, or ideas you've read in the literature. So you could list them all here. And after that, depending on your interest, you can prioritize them. So let's say you've prioritized 5 areas of research. You can list them all here, and then you can choose which one of these issues is more important. This can be done by yourself, like if you already feel like this is more important to me because I've been through it through my clinical practice and I believe this topic should be researched, or you can use the table that Dr. Marsban showed, and it is a part of the worksheet. So this table, as discussed before, has 5 criteria to help you prioritize the research. It's by appropriateness, importance, novelty, feasibility, and potential value. So for each one of your issues, you have a number. If it's, let's say you've had 5, so they're number 1, 2, 3, 4, 5. And you go through every question here, and it will help you decide, for example, if your first issue answers the first one, you can write for number 1. Let's say your first one focuses on, it's an intervention that's very important and it's been used a lot by scientists. So you can add it for here. If the other issues don't, you leave them blank. And this way, by the end, you can go through every question like that for every research topic you have. And by the end of
Angela, let me correct it.
Oh, sorry.
From 1 to 5, you see, for example, the alternative 5, how much meets appropriateness from 1 to 5. So we can compare the list of these alternatives from 1 to 5 for each alternative. Does it make sense? Okay,
yes,
it's not
so
1 and 0. The previous system was 1 and 0, but we changed the nominal group. This is the nominal group methodology. You can search it online. You can search it online for more clarification. But for each line, for each row, please score from 1 to 5. If the first alternative is more important, put 5 here. If the fifth alternative is the least important one, please put 1 here.
Yeah, my bad. I misunderstood.
Sorry for interruption. No, you were right. You explained according to the previous style that we.
Yes. So my apologies. So for this one, if you identified 5 issues, for each issue separately, it is graded. So for each question, you grade from 1 to 5 for each issue, with 1 being the lowest and 5 being the highest. And at the end of this tool, here at the total, you'll have a total number for each issue. It could be 15 for one when you add them all up. And the one with the highest is supposed to be the issue that should have the most priority, the issue that will have the most impact on research.
Absolutely. Thank you.
Yeah. Thank you so much and I apologize for the mistake.
Thank you so much for your contribution. I would appreciate Angela, Kinal, Isha, and Marzieh. Marzieh had a significant role in developing these ideas and these writings and drafts. So thank you all for joining. Let us know your questions, please.
This file that you just showed us, can you share it on chat box or let me know when it was emailed?
It was emailed today. Let me check the time. A few hours ago, I believe.
Yeah, I emailed it this afternoon. It was sent to everyone. If you don't receive it, check your spam folder as well. And I will check with you, Dr. Abolfalsli, just to be sure you have it.
And also, Doctor, we updated the web pages of research department on Larkin website. Please check the research web pages on Larkin website. We will put all of this material in addition to your email and sending out to your emails. We will put it on the website, but you should use your user pass. This is your privilege as a liaison to have a user pass for having access to this material. So we will grant you a user pass later, and you will have it as well in your educational material in the liaisons part. Your names, all of your names are in the liaisons page of our website, in the research department, research and academic affairs. You can check your names. You are our focal points in the clinical departments. So be proud of that.
That's great.
Dr. Amin, can you please share your email address in the chat, just to double check we have it in the list, please?
Let us know if you have received before the other members. Did you receive it?
I did receive today afternoon. So there was in fact one pre-workshop questionnaire, but I didn't check like my email this afternoon. I just saw, so I couldn't do it. But I do have all the documents now.
Okay, great. So please work on it until the next meeting. That would be in October. And let us know your questions. We will respond to your questions. We will help you and we will learn from you. You can come to our office and we will talk with each other and discuss your area of research. And we are here to help you. Just that. And that's it.
Appreciate that, Marspan. So just a quick question, like we have a great team now, you and also Laura. And so out of these worksheets, when we are filling, if we need to contact somebody, it would be you or who should be email if we need to?
Laura and Rishpa and Shruti.
Okay.
And Dr. Ricardo. All of them are doctors, and research people. They are experts in research, and we are working together every day. So you can ask them, and if there was something that was needed for me to contribute to the responding you or sending some additional resources to you, you can come to our office.
Okay.
We welcome your presence there and our discussion together.
Perfect. Thank you.
Bring your ideas, talk with your faculty, talk with other colleagues, and share these resources with other people, because the next step would be creating or building some research committees in your departments. So right now you are the focal point, the only person that we have, the focal point of research department there, but after a while, we will have a research committee there to help you in advance to promote the culture of research and do some research projects and achievements in your department. So communicate with your faculty, with program director, share these ideas, talk about it, have discussions for this assignment, for this worksheet. Ask them that we should do something for the worksheet, so we should talk with each other. And you can dedicate one of the didactics or allocate a time for didactics in your department to have discussions about finding research issues or topics. You can use our educational material to talk with your colleagues and your teams.
True. Thank you.
Thank you for a nice question, for a good question. Is there anything else?
Just
any comments, idea?
Yes. Where is your office located? On the 6th floor?
Yes, 6th floor and suite 601, doctor.
Thank you.
You're welcome.
Thank you very much, Dr. Marsban. I have a question, please.
Please.
Can we have access to the recording for the session?
Yes, of course.
Perfect. Thank you.
And you have access to the recorded. You have access to the recorded file as well on YouTube. So if you want to share this learning material with others, this meeting with others, you can share the YouTube link as well. Laura will send it to you.
Perfect.
How many absent persons we have, Laura?
We have a good assistance today. 18 persons were present. Congratulations to all. And yes, I believe we only have like 2 persons missing.
Okay, we can share the recorded meeting with them. And also we have a questionnaire. We have a questionnaire. Can you explain it, Laura?
Yes, I sent, it was a questionnaire sent today in the package to you. This is not a test. It's just a questionnaire for us to evaluate what will be the needs and what things to address through our training labs.
Okay, please help us know you better with this questionnaire. We know that there are some documents there, but you have 1 month time. So please spend your time in return to our efforts. We have worked 1 month together to provide this material in the best situation that we can, but we should improve it based on your ideas, your comments, and your criticism. So let us know your ideas, let us learn from you, and please fill out the questionnaires. Thank you so much for your joining and your afternoon time that you spent with us. Thank you so much. If there is nothing else, let us close the meeting.
Thank you very much. Appreciate your time.
Have a nice evening. Have a nice evening.
Thank you, everyone.
Thank you
Any
all.
questions, just let us know.
A pleasure for us.
Thank you.
Thank you. Thank you.
Bye-bye.
Thank you so much.
Thank you so much.
Thank you. You have a good day.